Okay, so as your book mentions, agoraphobia is not a fear of open spaces, as is often presumed. Rather, agoraphobia is a fear of being in a place or a situation where escape would be difficult or embarrassing. The other important thing to note is that prior to the publication of the DSM-5, agoraphobia wasn't recognized as a standalone disorder. It was actually a subcategory of panic disorder, so we're really just starting to understand the cause and prevalence of agoraphobia itself. According to the DSM-5, there are 5 key diagnostic criteria for agoraphobia. The first of those diagnostic criteria states that the person must experience marked fear or anxiety for more than 6 months about 2 or more situations. And these situations could include using public transportation, being in open spaces, being in enclosed spaces, standing in line or being in a crowd, or being outside of the home alone. The next diagnostic criteria states that the person fears and or avoids these situations because escape might be difficult or help might not be available. And the reason why the person might need to escape or need help is because the agoraphobic situations almost always provoke feelings of anxiety. Next, the DSM states that the anxiety must be out of proportion to the actual threat posed by the situation, which is something that we talked about with specific phobias as well. So we're not talking about the person having legitimate fears of escape or needing help, but rather illegitimate or unjustified anxiety. Finally, the DSM stipulates that the avoidance, fear, or anxiety must significantly interfere with the person's routine or functioning. So if the avoidance, fear, or anxiety is not interfering, then we wouldn't call the symptoms agoraphobia. It's only when the symptoms are impairing functioning that we meet the diagnostic criteria. The epidemiology of agoraphobia is just now being worked out because, as I mentioned before, it only became a standalone disorder with the publication of the DSM-5. However, current estimates suggest that about 2% of the population meets diagnostic criteria for agoraphobia. And, in keeping with trends for other anxiety disorders, onset is relatively early in life and women are twice as likely to be diagnosed. What's more, based on previous diagnostic information, we know that about 30% of people with agoraphobia also experience panic attacks or are diagnosed with panic disorder. And also that people who meet criteria for agoraphobia are at greater risk of other anxiety disorders, depressive disorders, and substance use disorders. The primary treatments for agoraphobia include pharmacotherapy or medication. The most common medication used to treat agoraphobia is selective serotonin reuptake inhibitors, or SSRIs, the purpose of which is to keep serotonin in the synaptic cleft for longer, so to inhibit the postsynaptic neuron from taking up or reuptaking the serotonin. Evidence has also been accumulated that cognitive behavioral therapy, particularly systematic desensitization and virtual reality exposure, may be especially effective. As you might guess, virtual reality exposure therapy involves the use of virtual reality, or even just imagery, in order to systematically expose the person to anxiety-provoking situations. The final anxiety disorder we'll talk about is generalized anxiety disorder, or GAD. Recent estimates suggest that between 4 and 7% of the general population meets diagnostic criteria, so more than agoraphobia and panic disorder, but less than specific phobias. Again, women are about twice as likely as men to be diagnosed, but unlike some other anxiety disorders, onset of generalized anxiety disorder is about 30 years of age, though there is a lot of variability in that, with people much younger and also much older being diagnosed. The diagnostic criteria for GAD are fairly straightforward, involving excessive worry more days than not for at least 6 months about a number of events. Next, the individual has to find it difficult to control the worry. The anxiety and worry has to be associated with 3 or more of the following symptoms: restlessness or feeling keyed up or on edge, being easily fatigued, having difficulty concentrating, being irritable, having muscle tension, or experiencing sleep disturbance. And finally, the symptoms have to cause significant distress or impairment. The most common treatments for GAD have been medications, for example, buspirone, which acts on serotonin and oxytocin receptors, benzodiazepines, which act on GABA receptors, and certain antidepressants. In addition, cognitive behavioral therapy has been widely used, with some studies showing that a combination of medication and CBT is most effective. When all else fails, and when you're trying to figure out what are the symptoms of any of the anxiety disorders, keep chaos in mind, that the symptoms cause impairment, that they involve a heightened anxious reaction or avoidance, that the symptoms are out of proportion to the perceived threat, and that the symptoms have lasted for 6 months or more. Although that's just relevant for GAD, agoraphobia, and specific phobia. So those are your lectures on anxiety disorders. Go ahead and take the quiz.